Hey everyone, and welcome back for another deep dive.
Yeah.
So today we're going to be tackling Lyme disease. And specifically, we're going to be looking at how tricky the diagnosis can be. And for this, we're going to be using a case study. It's a fictional one, but it's a really good one. And it comes straight from the OpenStax Microbiology textbook. There's a link for that in the video description if you want to check it out.
Oh, it's a great textbook.
Yeah, it's a really solid resource. So this case study, it's about this young woman, Kayla. She's just moved to New Hampshire and loves being outside, hiking, all that good stuff. And then she starts to feel kind of run down, a little feverish, headachy, muscles aching, just that general blah feeling. I mean, I feel like we've all been there, right?
Yeah, for sure.
So at this point, would you be thinking Lyme disease?
Probably not. I mean, those symptoms, they're so general, right? Could be a million things. I mean, could be something as simple as just a cold. Or maybe even, like a flu or something.
Yeah, okay, fair enough. But what if it was something more serious? Like, what if it was some kind of autoimmune thing?
Oh, yeah, definitely possible, too. I mean, you're talking about things like multiple sclerosis, lupus, even ALS, all those kinds of things could start off with symptoms like that.
Wow, okay, so we're already seeing how tricky this can be. But with Kayla, these symptoms, as mild as they seem, they just didn't go away. Like weeks go by and things actually start to get worse.
Yeah, and that's when things start to get really interesting, from a diagnostic standpoint at least.
Okay, how so?
Well, because new symptoms, they start to pop up. And those new symptoms, they give you more clues.
Oh, I see. So it's like a puzzle.
Exactly.
So what kind of new symptoms are we talking about here?
Well, Kayla starts to get joint pain, especially in her knees. And then she starts having these heart palpitations. Oh, and some weakness in her facial muscles, too.
That doesn't sound good.
And on top of all that, she develops a stiff neck. And the headaches, they get way worse, like really painful.
Wow, okay. So those initial, almost dismissible symptoms, they've turned into something a lot more, well, scary.
For sure. And I'm sure Kayla's freaking out at this point.
Yeah, for sure. But you said this helps with the diagnosis.
Yeah, because now you can start to rule things out. For example, those headaches and the stiff neck. You might think meningitis, right?
Yeah, that's what I would think.
But meningitis, that usually comes on pretty fast.
Oh, okay.
Not gradually over weeks like what's happening with Kayla.
Right. So each new symptom, it's like another piece of the puzzle.
Exactly.
Helping to narrow down the possibilities.
But here's the thing. A lot of Kayla's symptoms, they could also fit with ALS or even SLE, which is systemic lupus erythematosus.
Okay, so how do you decide between those and Lyme disease?
Well, you have to consider everything, right? And in Kayla's case, remember, she's an outdoorsy person. She loves hiking those New Hampshire trails.
Yeah, you said that.
So that, combined with her symptoms, it makes Lyme disease a real possibility.
So it's not just about the symptoms themselves, it's also about lifestyle and environment.
Exactly.
Huh, that's pretty interesting.
Yeah.
Makes you think, what are those things in your own life that might be affecting your health?
Right. It's a good thing to consider.
So, okay, we've got this young woman, Kayla. She's got all these symptoms that could be a lot of different things, including Lyme disease, but how do we know for sure?
Well, there's a couple of things that make Kayla's case even more tricky.
Okay, what's that?
First of all, she doesn't remember being bitten by a tick.
Yeah, that's important.
And second, there's no sign of that classic bullseye rash.
Oh, so no rash, no tick bite. Does that mean it can't be Lyme disease?
Not necessarily. See, that bullseye rash, it's a common symptom, but it's not a guarantee.
Really?
Yeah, like studies show that something like 20 to 30% of people with Lyme disease, they never get that rash.
Wow, okay, that's a lot of people.
So you can't just rely on the presence or absence of one symptom to make a diagnosis.
That's a really good point. So at this point, I'm guessing they start running some tests?
Yeah, definitely.
What kind of tests are we talking about?
Well, first the doctor orders an MRI of the brain, just to rule out anything going on up there.
Okay, makes sense.
And then a complete blood count. And also tests to check her liver and kidney function.
Right, got to cover all the bases.
And of course, specific tests for SLE and Lyme disease.
I mean, it's amazing, right? Like each test, it's like a piece of a detective's investigation.
Yeah.
Ruling things in, ruling things out, getting closer to the truth.
Exactly.
So what did the results show?
Well, the good news was that the SLE and ALS tests were negative.
Oh, phew. That's good. But what about the Lyme disease test?
That one, it came back equivocal.
Equivocal? What does that even mean?
Basically, it means inconclusive. Not clearly positive or negative.
Oh, that must be so frustrating.
Oh, it is. It's like being stuck in limbo.
Yeah, you don't know what to think. Exactly.
But so what happened next?
Well, this is where Kayla's doctor made a really important decision. Even though the Lyme disease antibody test was inconclusive, she still suspected Lyme disease.
Wait, really? Why would she do that?
Well, Lyme disease is notoriously hard to diagnose, especially in the early stages. So even with a negative or even an inconclusive antibody test, Lyme disease could still be the culprit.
It's definitely possible.
Okay, but how does that even work?
Well, antibody tests, they work by detecting the antibodies that your immune system makes when it's fighting off an infection, right?
Right.
But in the early stages of Lyme disease, there might not be enough antibodies yet for the test to pick them up.
Oh, I see.
It's like trying to hear a whisper in a windstorm. You might miss it completely.
Wow, that's a great analogy. So if the standard antibody test isn't always reliable, what other options are there?
Well, there's a type of molecular test called ELISA that can sometimes detect those early antibodies.
Okay, so is that what they did with Kayla?
They could have, but even ELISA isn't perfect. And Kayla's symptoms were pretty severe, and they just weren't letting up.
So what do they do?
Her doctor decided to dig a little deeper
Okay.
by ordering some more specialized testing.
Okay, so things are escalating a bit now. What kind of tests are we talking about here?
Well, this time, the doctor wanted to look at 3 specific types of samples.
Okay.
Blood, obviously, but also cerebrospinal fluid.
Cerebrospinal fluid.
Yeah, that's the fluid that surrounds your brain and spinal cord.
Oh, right.
And then synovial fluid.
Synovial fluid. Now that's a new one.
Yeah, it's the fluid that lubricates your joints. And in Kayla's case, they would have taken that from one of her swollen knees.
Wow. Okay, 3 different samples. I mean, you can tell the doctor's not messing around at this point.
Right.
But why those specific fluids?
Well, it's all about getting a more complete picture of what's going on. Like, analyzing these fluids, it can tell you if the infection has spread.
Oh, okay. Spread to where?
To the central nervous system or to the joints.
I see.
And in Kayla's case, remember, Lyme disease is still a suspect. And these fluids, they're key because the bacteria that causes Lyme, Borrelia burgdorferi, it can sometimes hide out in those places.
Oh, wow. So it's like a hide-and-seek game.
Kinda, yeah.
Making it hard to find with just a regular blood test.
Exactly.
Okay, so they've got these 3 samples now. What do they do with them?
They send them all for PCR analysis.
PCR.
Yeah, polymerase chain reaction. You probably heard of it. I mean, it was all over the news with COVID testing.
Oh, right. PCR tests.
Yeah, exactly.
So what is PCR exactly?
It's a really powerful technique. It lets scientists amplify tiny amounts of DNA so you can detect even the smallest trace of a pathogen.
Oh, cool.
Like in this case, Borrelia burgdorferi.
So it's like a super-powered magnifying glass.
Yeah, exactly.
Looking for clues that would be invisible to the naked eye.
Exactly.
So what did this super sleuth find in Kayla's case?
Well, this is where we finally get a breakthrough.
Oh, okay. Tell me.
The PCR test on Kayla's cerebrospinal fluid and synovial fluid, they both came back positive for Borrelia burgdorferi.
Wow. Finally.
So after all that, we finally have a definitive diagnosis. Lyme disease.
Well, what a relief. I mean, I can only imagine how Kayla must have felt.
Yeah, I'm sure it was a huge weight off her shoulders.
So what happened next? Did they start treatment right away?
Yeah, they did. Her doctor prescribed a course of doxycycline.
Doxycycline? What's that?
It's a common antibiotic. It's often used for Lyme disease.
Oh.
And the good news is that Kayla made a full recovery within a few weeks.
That's fantastic.
But, you know, Lyme disease can be a tricky beast.
Oh, yeah.
Like, even after treatment, sometimes people still have lingering effects.
Oh, really? What kind of effects?
Things like fatigue, muscle and joint pain, even brain fog.
Oh, wow. That sounds awful.
Yeah, it's called post-treatment Lyme disease syndrome.
Post-treatment Lyme disease syndrome.
Or PTLDS for short.
Okay, PTLDS.
And it's a bit of a mystery. We don't fully understand why it happens.
So what causes PTLDS?
Well, there are some theories. Some researchers think it might be an ongoing immune response.
Interesting.
Like the body's defense system is stuck in overdrive.
Even after the infection is gone?
Yeah, even after the threat is gone.
Wow, that's crazy.
Others think it could be damage from the bacteria during the initial infection.
So what can you do about it?
Unfortunately, there's no one-size-fits-all treatment for PTLDS.
Well, that's tough.
But a lot of the time, it's about managing the symptoms. Things like pain management, physical therapy, even cognitive behavioral therapy.
Okay, so it's about improving quality of life.
Yeah, exactly.
Well, I think this is a good place to pause for now. We've covered a lot of ground already. But when we come back, we're going to delve deeper into Lyme disease prevention and also talk about some of the latest research and what it might mean for the future of diagnosis and treatment. So stay tuned. And we're back talking all things Lyme disease.
Lyme disease, it's a fascinating one, that's for sure.
It is. And before the break, we were talking about this fictional case study, Kayla, and how even after all those tests, her doctor still suspected Lyme disease, even though the antibody test was inconclusive.
Yeah, it's a classic example of how Lyme disease can be so tricky to diagnose.
So where did they go from there? What happened next?
Well, since Kayla's symptoms were so severe and they just weren't getting any better, her doctor decided to order some more tests.
More tests. Okay, so things are getting serious now.
Yeah, these were more specialized tests to really dig deep and see what was going on.
So what kind of tests were these?
Well, this time they decided to look at 3 different types of samples.
3. Okay, what were they?
So first, they took a blood sample. That's pretty standard.
Yeah, that makes sense.
But then they also took a sample of cerebrospinal fluid.
Cerebrospinal fluid, what's that?
It's the fluid that surrounds your brain and spinal cord.
Oh, wow, okay.
And lastly, they took a sample of synovial fluid.
Synovial fluid. Now, I have no idea what that is.
That's the fluid that's in your joints. It helps to lubricate them. So in Kayla's case, they would have taken that from one of her swollen knees.
Oh, wow. Okay, so blood, brain fluid, and joint fluid.
Exactly.
You can really tell they were pulling out all the stops to figure this out.
Right. They were leaving no stone unturned.
But why those 3 specific fluids?
Well, each one can give you different clues about what's happening inside the body.
Okay, how so?
For example, analyzing the cerebrospinal fluid, that can tell you if the infection has spread to the central nervous system.
Oh, I see. So it's like checking to see if the infection has gotten into the brain and spinal cord.
Exactly.
And what about the synovial fluid?
That can tell you if the infection has spread to the joints, which is common with Lyme disease.
So by looking at all 3 fluids, they can get much better picture of where the infection is and how serious it is.
Exactly. It's all about getting a more complete picture.
Okay, that makes sense. So they've got these 3 samples. What do they do with them?
They send them all for something called PCR analysis.
PCR. I've heard of that. Is that the same thing they use for COVID testing?
Yes, exactly the same technology.
Okay, so remind me, what is PCR exactly?
PCR stands for polymerase chain reaction. It's a technique that basically lets you amplify tiny amounts of DNA.
Amplify, so like make more of it.
Yeah, exactly. So even if there's just a tiny trace of a pathogen like a bacteria or virus in the sample, PCR can make millions of copies of its DNA, so it's easier to detect.
Wow, that's pretty amazing.
It is. It's incredibly powerful technology.
So it's like having a superpowered microscope.
Yeah, that's a great way to put it.
So what did they find when they ran the PCR tests on Kayla's samples?
This is where things get really interesting. The PCR tests on Kayla's cerebrospinal fluid and synovial fluid, they both came back positive for Borrelia burgdorferi.
Wait, really? Both of them?
Yes, both of them.
So that means...
That means Kayla definitely had Lyme disease.
Wow, finally a definitive answer. After all that uncertainty, they finally knew for sure.
I know, it must have been such a relief for her.
Yeah, absolutely.
And the good news is that Lyme disease, when it's caught early enough, is usually curable.
Oh, good. So what did they do to treat her?
Her doctor prescribed a course of doxycycline.
Doxycycline.
It's an antibiotic that's commonly used for Lyme disease.
Oh, okay.
And luckily, Kayla responded really well to the treatment.
That's great to hear.
Yes, she made a full recovery within a few weeks.
That's fantastic.
But, it's important to remember that not everyone is so lucky.
What do you mean?
Well, sometimes, even after treatment, people can still experience lingering symptoms.
Really? Like what?
Things like fatigue, muscle and joint pain, problems with concentration and memory, even mood changes.
Oh, wow, that sounds awful.
Yeah, it's called post-treatment Lyme disease syndrome, or PTLDS for short.
PTLDS. I've never heard of that.
It's not as well known as Lyme disease itself, but it can be really debilitating for those who experience it.
So what causes PTLDS?
Well, the truth is we don't fully understand it yet.
That's frustrating.
It is.
Yeah.
But there's a lot of research being done to try to figure it out.
Okay, well, let's hope they find some answers soon. But before we move on, I just want to recap something you said earlier. You said that Lyme disease can be really hard to diagnose, especially in the early stages.
Yes, that's absolutely true.
And that's because the standard antibody tests aren't always reliable.
Right. They can sometimes miss the infection, especially if it's early on.
So what should people do if they think they might have Lyme disease, but the tests come back negative?
That's a great question, and it's really important. First of all, don't panic, but don't ignore your symptoms either.
Okay, so what should they do?
Talk to your doctor, be honest about your concerns, and advocate for yourself.
Advocate for yourself. What do you mean?
I mean, if you really think you might have Lyme disease, even if the initial tests are negative, Push for more testing, maybe those specialized tests we talked about earlier.
Okay, so be persistent.
Exactly. Don't be afraid to ask questions and push for answers.
I think that's really important advice for anyone dealing with any kind of health issue, really.
I agree. It's so important to be your own advocate.
So let's shift gears a little bit and talk about prevention.
Okay, prevention is key. Absolutely.
What can people do to protect themselves from Lyme disease in the first place?
Well, first of all, awareness is huge.
Awareness.
Yeah, just knowing that Lyme disease is a risk, especially if you live in or visit areas where ticks are common.
Okay, so know your enemy, so to speak.
Exactly. And then take steps to avoid tick bites.
Like what?
When you're spending time outdoors in areas where ticks might be lurking, wear long pants and sleeves.
Okay, cover up.
Yeah, and tuck your pants into your socks.
Tuck your pants into your socks. Now, that's not very fashionable.
I know, but it can really help to prevent ticks from getting to your skin.
Okay, I'll do it for the sake of Lyme disease prevention.
And use insect repellent. One that contains DET is most effective against ticks.
Okay, got it. DT it is.
And then, when you come back inside, do a thorough tick check.
A tick check. What's that?
Check your entire body, head to toe, for any ticks that might have latched on. Pay special attention to areas like your scalp, behind your ears, under your arms, in your groin area, and behind your knees.
Okay, so be thorough.
Yeah, those little buggers can be sneaky.
They sure can.
Yeah.
So wear protective clothing, use insect repellent, and do tick checks.
Exactly. Those are the three main things.
Great advice.
Yeah.
But what if, despite all your best efforts, you do get bitten by a tick?
Well, the first thing is to remove the tick as soon as possible.
How do you do that?
Use fine-tipped tweezers to grasp the tick as close to the skin's surface as possible and pull upward with steady, even pressure.
Don't twist or jerk, right?
Right. You don't want to leave the tick's mouth parts embedded in your skin.
Okay, so tweezers, steady pressure. Got it.
And once the tick is removed, clean the bite area with soap and water or rubbing alcohol.
Okay, good hygiene is always important.
Exactly.
So what happens next? Should you see a doctor right away?
It's a good idea to call your doctor just to let them know you were bitten, especially if you start to develop any symptoms like fever, rash, muscle aches, or fatigue.
Okay, so better safe than sorry.
Exactly.
Well, I think this has been a really informative discussion. We've covered a lot of ground, from diagnosis to treatment to prevention.
Yeah, it's been great.
But before we wrap up, I want to circle back to something you mentioned earlier. You said that Borrelia burgdorferi, the bacteria that causes Lyme disease, it can actually have different variations or strains.
Yes, that's right.
Can you tell us a bit more about that? Why is it important to understand these different strains?
Sure. So not all strains of Borrelia burgdorferi are created equal.
Okay, so what's the difference?
Well, some strains are more aggressive than others.
Aggressive? You mean they cause more severe symptoms?
Exactly. Some strains can cause more serious complications, like neurological problems or heart problems.
Oh, wow, that's scary.
And some strains are better at evading the immune system.
Evading the immune system, what does that mean?
It means they're harder for your body to fight off.
Oh, so that means they might be harder to treat?
Exactly. They might require longer courses of antibiotics or different types of antibiotics.
Okay, so understanding these different strains is important for treatment.
Absolutely.
Is there anything else that's different about these strains?
Well, some strains might actually trigger different types of symptoms.
Really? So you might not always see the same symptoms in every case of Lyme disease?
Exactly. It can vary depending on the strain of bacteria involved.
Wow, that makes diagnosis even more complicated.
It does, but the more we learn about these different strains, the better equipped we'll be to develop more targeted treatments and prevention strategies.
That's a good point. Well, sadly, we're out of time for this part of our deep dive. But when we come back, we'll delve deeper into the world of Lyme disease research and explore some of the exciting breakthroughs that are on the horizon, so stay tuned. And we're back, wrapping up our Lyme disease deep dive.
It's been a journey, that's for sure.
It has. Before the break, we were talking about how different strains of Borrelia burgdorferi can affect how severe the disease is, and even the kinds of symptoms people have.
Right, it's not a one-size-fits-all kind of thing.
So let's talk about treatment.
Okay, treatment.
We know antibiotics are the main way to treat Lyme disease, but are all antibiotics the same?
Well, not exactly.
So how do doctors decide which antibiotics to use?
It depends on a few things.
Like what?
Well, first of all, it depends on the stage of the disease.
Stage. What do you mean?
Like, how long has the person had Lyme disease? If it's caught early, the treatment is usually simpler.
Okay, and what if it's not caught early?
Then it might be a bit more complicated. And it also depends on the individual patient.
So it's not a one-size-fits-all approach.
Definitely not.
So for early Lyme disease, what's the usual treatment?
Usually it's a course of oral antibiotics.
Oral antibiotics, so like pills.
Yeah, exactly.
What kind of pills?
There are a few different ones that are commonly used: doxycycline, amoxicillin, cefuroxime. Those are some of the most common ones.
Okay, and how long do people have to take them for?
Usually for about 10 to 21 days.
Okay, so a couple weeks of antibiotics, and then you're good to go.
Hopefully, yeah.
But what about those more serious cases, like where the infection has spread to the heart or the joints or even the nervous system?
Yeah, in those cases, the treatment is a bit more aggressive.
Aggressive? How so?
Well, instead of oral antibiotics, they might need intravenous antibiotics.
Intravenous, so like through an IV.
Exactly.
Wow, that sounds serious.
It is, but it's necessary to really knock out the infection in those more severe cases.
Okay, so what kind of IV antibiotics do they use?
Ceftriaxone and penicillin are two of the most common ones.
Okay, and how long do they have to be on those for?
Usually for a longer period, maybe 2 to 4 weeks.
Wow, that's a long time.
It is, but it's important to make sure the infection is completely gone.
Yeah, I can see that. So treating Lyme disease, it's not always easy.
No, it can be quite challenging, especially in those more complicated cases.
And there are potential side effects from the antibiotics too, right?
Yeah, unfortunately, all medications come with potential side effects.
So what are some of the possible side effects of these Lyme disease antibiotics?
Well, some of the most common ones are stomach upset, diarrhea, nausea. Some people might get allergic reactions like a rash or itching. And in more rare cases, there can be more serious side effects.
Okay, so it's important to be aware of the potential risks and benefits
Absolutely.
and to have a good conversation with your doctor.
Yes, definitely. Make sure you understand the treatment plan and ask any questions you might have.
That's good advice. Well, let's shift gears a little bit now and talk about the future of Lyme disease research.
Okay, the future of Lyme disease research.
What are some of the most exciting areas of research right now?
Well, one area that's really promising is vaccine development.
A vaccine for Lyme disease?
Yes, that's the goal.
But wait, I thought there used to be a Lyme disease vaccine.
You're right, there was a vaccine called Lymerix. It was approved in the U.S. back in the late 1990s.
So what happened to it?
Unfortunately, it was withdrawn from the market in 2002.
Why? Wasn't it effective?
It actually was quite effective. It provided about 78% protection.
So why did they pull it?
There were a few reasons. First of all, it required multiple doses and a booster shot, which made it a bit more complicated than some other vaccines.
Okay, that's not ideal.
And then there were some concerns about potential side effects.
Side effects like what?
Mainly joint pain. It was a rare side effect, but it was enough to scare some people away.
Right, I can see that.
And unfortunately, those concerns, along with the relatively low incidence of Lyme disease at the time, it led to a drop in demand for the vaccine.
So it wasn't that the vaccine didn't work?
No, it worked quite well, actually.
It's just that people weren't getting it.
Exactly.
That's really unfortunate.
It is, but the good news is that the quest for a Lyme disease vaccine hasn't ended.
Oh, that's good to hear.
Yeah, there are several research groups around the world that are working on new vaccines.
So what are these new vaccines like?
Well, some of them are targeting different proteins on the bacteria, which could potentially reduce the risk of side effects.
Interesting.
And others are using innovative delivery systems, like nanoparticles, to enhance the immune response.
Wow, that sounds really cutting edge.
It is, and there's a lot of hope that these new vaccines will be safer and more effective than the previous one.
Okay, so vaccines are one promising area of research.
Yes.
What else is on the horizon?
Another exciting area is the development of new diagnostic tools.
New diagnostic tools.
Yeah, we know that early diagnosis is crucial for preventing long-term complications from Lyme disease. And right now, the diagnostic tests we have aren't perfect.
So what kind of new tools are they developing?
Well, some researchers are looking at biomarkers.
Biomarkers?
Yeah, they're like little signals in the body that can indicate the presence of a disease.
Oh, I see.
So if we can identify specific biomarkers for Lyme disease, we could potentially diagnose it much earlier.
That would be amazing.
And other researchers are working on new imaging techniques that could actually allow us to see the bacteria in the body.
Wow, that's incredible.
It is, and it could really revolutionize the way we diagnose and treat Lyme disease.
So it sounds like there's a lot of exciting research going on.
There is, and it's giving us a lot of hope for the future.
Well, that's fantastic. Well, listeners, that wraps up our deep dive into the world of Lyme disease. We've covered a lot of ground today. From the basics of the disease to the challenges of diagnosis to the latest research.
It's been a great discussion.
It has, and I hope everyone listening has learned something new. If you want to learn more, I highly recommend checking out the OpenStax Microbiology textbook. There's a link to it in the video description.
It's a great resource, very comprehensive, and easy to understand.
And most importantly, remember that Lyme disease is a serious illness, but it's treatable. If you have any concerns, don't hesitate to talk to your doctor.
And remember, early diagnosis and treatment are key.
That's right. So stay safe out there, everyone. And until next time, keep those minds curious.